Thank you, Mr. Maper. I appreciate it. I appreciate everybody being here live during the meeting and all those who are watching this recorded. Our goal as an organization is always to bring you ideas and bring you value to your stores. We hope that the ideas that we share within this hour or so meeting have some value, or at least start some ideas within your business for ways for you to become more profitable and to grow your business. And so with that, I think I'm leading off. So if someone wants to toss up my slides there, I'd appreciate it. So I own two pharmacies here in Broken Arrow, Oklahoma. And I am pharmacist in charge at one of those two stores. So I'm behind the counter. I see the things that you as owner operators see every day. And our flagship store has been open 22 years. Our second location opened 10 years ago this December. And as time has gone on, marketing is kind of my thing. Trying to think outside of the box on ways creative ways to bring more people into the store. During this time of COVID, this last 15 months now, 15 or more months that we've been administering vaccines, we've gathered a lot of data. And that data, Dave, if you'll roll me to screen number 2 there, there's a lot of stuff that all of us who have done COVID vaccinations, there's a lot of data that we have gathered. We've gathered a bunch of names. We've gathered all of their addresses. We know their birth dates. We know whether they're male or female. We know at least certain of their disease states that we asked in the basic screening. And we know what their insurance plan is, most of them, whether they're a Medicare patient, whether they're commercially insured, or whether they're uninsured. And where I wanted to go with my part of the presentation is, what are you doing with that data? You have an opportunity to filter through that data and do all kinds of things, all kinds of marketing opportunities with your patients, where you can specifically target a number of patients for marketing ideas. And I do want to, even though the gist of this presentation is post-COVID, if you will, post-COVID, and how we're slowing down on vaccinations and slowing down on testing, I do want to point out that the pandemic is not over. I realize that it's transitioning into what some call a more endemic state, but we're still giving boosters, which eventually will probably transition to something like a yearly flu shot or an every 6-month shot for certain age groups. And right now, of those people who you have vaccinated, less than 50%, it's only about 46% of people nationally got their first booster. We had a large rush of folks who got initial shot and then second shot if they used Moderna or Pfizer. But more than half of the United States, more than half of the population that are considered fully vaccinated only got their 2 shots. More than half of them did not get a single booster. And you have all of this information here in front of you, where we were getting paid $40 a shot. You're probably not getting paid $40 a prescription on a lot of the things that you're dispensing. And so this is a pretty low hanging fruit for you to contact these people back and have maybe develop some sort of a script or a talk sheet for your staff when they call these folks and say, hey, you probably need to come in for a booster. It's a pretty easy opportunity for you to increase your profitability right there. I realize that uninsured patients, the government has run out of money in that fund, and so uninsured patients you wouldn't get paid on. But those that are commercially insured, as long as the state of emergency, the federal state of emergency is still in place, you still get paid $40 a shot for those folks. So it's pretty low hanging fruit if you go back through and see who has not received that third shot. But you have all this information. What are you going to do with it? How can you market to these folks? And so I want to just give you 4 simple things to ask yourself when you're trying to think through what do I want to market to these folks and how. So question number 1 is, what are you wanting to market to patients? What is your specialty? What is your niche? What is profitable for you? Is it are you looking for cash business? Are you looking for more compounding business? Are you looking for a specific type of compounding business? Is there a particular third party that pays well for you in your market? You have that information from those patients that have come in and gotten vaccinated, and you also have an idea how close they are. You don't need to market to someone who is maybe 2 or 3 towns over from you. You can market to just those folks who came to see you that were from your immediate market. So what are you wanting to market? To whom are you going to market that product? We kind of discussed that. You have the information. You can sort it by age groups. You can sort it by sex. You can sort it by insurance plan, however you prefer to. The third thing, how do you best reach them? That's a trickier question. Is it mail? Is it some sort of a direct contact? Have you found out that a lot of folks from maybe a senior retirement center came to you for vaccination, and maybe you can go to that senior center and do something, promote your business somehow at that senior center? Since those people have been to your place, they know what your pharmacy looks like. They know the services that you provide, that it's a more cozy, friendlier environment. So maybe you can go out, have a second touch with them, if you will, at their place, and encourage them to come to you. And then the last question is, how much are you willing to spend per person to get them? You have to figure out a budget for what you're going to do. One of those things in marketing that it took me a while to get to, but I finally got to it, was how much am I willing to spend if I can guarantee that person is going to walk in my door? And you'll find that number may be higher than what you might initially think. Are you willing to spend $20 for a person to come walking in the door if you know that you're going to be able to retain them as a customer? Determine what's within your budget, how much you're willing to spend per person to get them in the store, and then you can start thinking of ways, how can I encourage that person to get into the store? Dave, if you'd be so kind as to roll back up to that first frame here real quick. I want to show you folks something that we do in our store. It kind of started subtle, and it's not really related to reaching outside of the store, but hopefully it stimulates some thought about how can we do something different that might draw people into the store. The picture in the upper left-hand corner there is me at my work counter, and you'll notice down at the end of the counter there's a quilt hanging on the wall. My wife and my mother-in-law, who's now passed, they're quilters, and we would hang quilts around the store, and people would just love those quilts. We would hang them as decorations, conversation pieces, those kind of things. It just brought a sense of comfort, I think, to some folks, homey, if you will. Dave, if you'll roll down to that third slide again, please. The picture that you see here, my wife's heart is in quilting. And so what we decided to do, just as something different, something to draw customers into the store, is we put together a small quilting section in our store. My wife knows that part of the business. I really don't. I gave her some money and I cut her loose. on that and allowed her to build that section as she wanted to. And she has a knack for that kind of thing. She has a knack for colors and patterns and those types of things. We're not trying to compete with big fabric stores or big quilting stores. What we did was we set up a small area in the store where we have small patterns that folks can do just over, in an evening or in a weekend or that type of thing, and a few fabrics. And I'm not going to pretend to know what these terms mean, but things like jelly rolls and fat quarters, and those terms mean something to quilters. They don't mean a whole lot to me. But my wife did all this, set it up, and now I want you to think of the demographic that this draws for you. For us, it draws a demographic of females over 45 typically, and they spend time and money, discretionary money, there in the store. And those are the same people that you want to target. That's the same demographic that you usually want to target for prescriptions. It's usually the female head of household that makes the decision what pharmacy to use. It's usually folks over the age of 45 that use more prescriptions. So it fits a good target demographic for someone to come in to the store. So my part of this presentation was to try and encourage you to use the data that you have and think outside of the box. Will you have to probably spend some money? Yes, but if by thinking outside of the box and targeting the way that you use that data, you have an opportunity here to really improve your profitability in the store and increase your volume. And I appreciate you taking the time. Thanks, Dave.
Hey, Todd.
Yes, ma'am.
A quick question. How much time did you say you devoted to COVID testing and immunizations before versus now?
We've administered since probably February of last year. We've administered about 4,500 vaccinations between the two stores. We've moved all of them into one of our two stores now because it's a larger footprint. We have room for more people. We previously were administering vaccinations 5 days a week, counting a Saturday, 5 days a week. Now we're administering 2 days a week. We've dropped Johnson & Johnson altogether. We are administering Pfizer on Saturdays because that's the day that kids are out of school, and kids can take Pfizer but not Moderna. And Moderna's we do on Tuesdays. And we're doing now on those days, we're doing about 20 vaccinations a day. Whenever we were doing them 5 days a week early on in the vaccine rollout, we were doing upwards of 120 shots a day.
I'm going to bring on Sonia Martinez. Sonia is second vice chair of our friends over at AAP and owner of Marco Drug and Compounding.
Thank you, everybody. Thank you, Dave. Thank you, Todd, TW, and everybody, PFOA, that are having me here. It's a pleasure to try to you think that I can bring some value to you guys and what I'm doing. My presentation is a little bit more, I guess, simpler. We call it to core, back to core, or what I call it's a back to basics. And what that means for us is kind of what is our core business and dedicated to our core business. We live in Miami, we're in Miami. It's a kind of metropolitan. We are between two CVS's and a Walgreens nearby. So the amount, I never got to do 100 shots, but we were doing about maybe 40, 50. So now it's maybe 3 or 4 a day. We're doing it every day. It's just create some convenience, even though I hate to waste some vaccines, but basically that's what we're doing. But with that extra time, what we are doing is, besides as you see here in this slide, that we're moving to a new location. About 2.5 years ago, we purchased a property. COVID happens, and a lot of stuff happened, and construction is still going through. Hopefully, towards by September, we should be moving. But that is creating some challenges and some drag on cash. So because basically we're paying two mortgages, so the mortgage over there and the rent what we're paying here. And our core business is compounding. I don't want to take out TW's thunder, but for me, basic is working, selling, entertaining the doctors, kind of getting the doctors that are coming nearby to reinforce that we are going to be moving where we're going to be moving, and that what we do as a compounding. But what I think is a hanging fruit for most everybody, it's the front end. I think that it's a very neglected. I do a lot of more in vitamins and a kind of specialized or private label and professional line vitamin that I do in a lot of prescriptions, no compounding, of course. Basically in the pharmacy, I eliminate every single low budget vitamin. And if people will buy a vitamin, they have to pay sometimes top dollars. Maybe a vitamin C is $20. Some people will say, oh, maybe because in Miami, you are maybe in a upscale area. Not so much. We have there's a friend of mine who works in a neighborhood called Hialeah, which is a middle to low income, and they are doing a killer over there. So I will encourage everybody to look for professional lines, and we use a lot of pure encapsulations, Douglas Lab, orthomolecular. And what I consider even better, it's our own private label, which people can only come to us to buy through us. And we do that through Wellness Work. And we buy 1 off or 10 off, depends on this. So there's no minimum. They design your own label for you. And now, voila, you have your own private label. Most of your customers want to support. We have a lot of people who say, no, I want your brand. I want to help you, and I trust you. So this is an opportunity for many people. This is a shout out for the people from Wellness Work. They're easy to work with, and they're a PCCA member company, but you don't need to be a PCCA member to become part of their line. Their vitamins are awesome. And actually you're gonna get 50 gross in those supplements. And then another things that we're doing, even though we're gonna be moving, I'm taking care of my front end. As you know, a part of my introduction with David, I'm a AAP, one of the board directors. So I support a lot of our programs, and we have a retail planogram program where I get money for my front end just to having their products that they want, where we can get rebates on. So I think that it's an opportunity for you. The program doesn't cost anything. You buy the OTC products directly from Cardinal, and you get money for it. It's kind of like a no-brainer. And I'm gonna include something that it's not on my slide, but I just learned this afternoon. Do you know the merger about Align and Arete and PPOK? And now we got a Align RX. They have part of the program is going through their Switch RX link. Today I got 847 with 17 cents in vouchers program with RX link, just to process the brand name medications that they support a lot of branded products that we are doing. I'm doing nothing for that. It's just processing the claim. Even though if the claim is covered or not, the manufacturers pays you. And I just got today $844 with 17 cents that I was not counting on, just because I switched my Switch to RX link. So basically that's going back to basic, without doing much and doing what you're doing daily, we're getting extra money. I don't know if any of you have any questions for me.
How
Hey,
long, this is Larry, how long have you been doing the private label vitamins?
About 3 years. Basically, when Wellness Works started, I jumped because it's kind of like it was like easy because we can buy one up. There's no minimum purchases. And it's doing phenomenal. I have an end cap. As soon as maybe I should have get a picture of my end cap. As soon as people enter, it's right there. All my Marco drugs, whatever.
What are a couple of your top sellers?
Vitamin C, zinc. Well, right now it's basically all immune support. They have an immune support. Ashwanda. Basically, that's right now what are my top sellers. Vitamin D. Everything is being focused on immune support.
Awesome, thank you. I will look into that.
Oh yes, it really it's a no-brainer.
Excellent. Other questions for Sonia at this point?
Hey, Sonia, do you get your techs involved in, do your techs are they kind of a lead on the vitamins?
Yes, basically they're being learned for me. So I've been doing several trainings with the same companies that we purchase the vitamins. They have a lot of webinars. So if you want to become well-versed, you will need to invest some time in learning. And that is information that my technicians can watch the webinars or learn from me. And they're making the cells themselves. For me, if the patient wants me to go out of the counter and go outside, he has to pay my time. So that's why I choose to have professional lines and my private label where I can get 45, 50 gross, sometimes even more.
What was the name of your switch again?
I'm sorry, the switch is RX Link. It's through Align.
Oh.
So it's costing me a penny more because I have Pioneers on my pharmacy system. But when I got the first voucher, I said, what, this is money. So I didn't pay attention. But today I just got a whole month from April and was $800 without doing anything, nothing else except going through the claims, which I found fascinating that, hey, get $844 just to keep doing what I'm doing. It's pretty cool. Just for filling prescriptions. And that's one of the benefit of Align RX. So you can call them and ask for more. So I'm not trying to sell anything. It's just, wow, when I saw that after later this afternoon, I said, wow, cool. So that's a great way to go back to basics.
Great. Sonia, thank you. I'm going to turn it over to T.W. Taylor, who is one of our board members. And if you haven't spent time talking to TW before, you're in for a very good treat. TW, I'm going to let you take it and run with it.
All right, does everybody see my slides okay?
Yes, sir.
All right. I have a different take on some of this stuff than regular pharmacists. I hope I don't come off too much over the top. I think that these COVID patients are your responsibility. And I don't want to take credit for all the information I'm giving you. I've taken a lot of it from Pam Smith and some from Sebastian Dennison. If you don't know who Pam Smith is, or Sebastian for that matter, I mean, they're just phenomenal people. Dr. Smith is big in teaching at A4M and PCCA and a number of other seminars and places. I wanted to throw this, a lot of the slides I've got in here tonight, guys, is probably more than you need to know, but I wanted to throw it in. This is a really good slide to kind of show you how the disease progresses. And you end up with long haul COVID. If you talk to Sebastian, it's all about activating TLR4 and TLR9. 9 is really the bad one. So tonight, my objectives is to first identify, there's really about 4 stages we have in here. It's either you're trying to be preventative, you've been exposed, or you have a mild case, you are positive and have a moderate case, you have a hospital admission or a severe case, or you have long haul COVID. And so I put the information there, what those definitions are. And the bottom line to this, it's all about your immune system. And to get even more of a finer point on it, it's really about the mast cells. When the mast cells lyse, that's where you're getting all the stuff released to get the cytokine storm. And so mast cells, if you never activate the mast cells, then you never get the cytokine storm. And I want to throw out there that CBD actually stabilizes mast cells. And I can tell you, Dr. Smith is huge on melatonin, and we'll talk some more about that in a few minutes. So what can you do in your pharmacy? Well, prevention and/or asymptomatic or mild COVID. I agree 100% with Sonia. Every one of us should be selling professional, pharmaceutical, third-party tested supplements. And all supplements from all companies are not the same. So for instance, she mentioned Pure Encapsulation, Douglas, Metagenics, Thorne. All of those companies have been sold out to either Nestle or private investors. And so personally, I'm trying to get away from them because the quality is not going to be what it used to be. I primarily focus, and I do use Wellness Works, Botics Research, Orthomolecular, Designs for Health. In this particular case, I like immune support packs by Botics Research. It has everything in there. The person can take these 5 capsules, and it's got lysine, quercetin, zinc, D, etc. It's all in there. So it's a nice pack they can take. They open up, there's 30 packs in the bottle. You open a pack a day. I cannot promote iodine nasal spray enough. We use Cofix, got a bottle right here. It's just excellent. It's preventative. It kills virus. It stops you from building the viral load. It's just terrific. I use a lot of nitric oxide. Nitric oxide works on everything, including your immune system. It helps with perfusion. And again, Ananda full spectrum CBD. Those are the things that I really try to push on people. Remember, it's your responsibility to give people their choices. It's their decision what and how much to buy within their budget. If they can't afford any of that and they say, look, I can't afford all that, I just want 1 or 2 things, then you need to give them at least vitamin D3 and zinc. Zinc, you want about 50 milligrams of elemental, and vitamin D3. If you want a rule of thumb for how much a person should get, use 45 IUs per pound, and that'll get you pretty close to a dose that they should be taking. Like Sonia, it's hard to train your staff. We started out doing a webinar every Thursday morning to train my staff. Now we do it through POA, and we send it out to however many hundreds of pharmacists. I know they have 500 and some, and I send it out to another 100 and some duplicates in there, I'm sure. And it's hard to just get people, engaged. And this opportunity is huge. Sonia's exactly right. If I can sell $10,000 worth, or 20 or 30 or 40, which, we actually do more than that, that's all at 50% plus. And as you increase your sales, you get to buy better discounts from these people. And that even adds to your profits more. And so huge opportunity there. And this is all the preventative or mild cases or asymptomatic patients. If they're positive, but they're kind of moderate, that means that they've been to the ER or they've had an overnight stay. They were sick enough to get some attention. Again, the nasal spray, vitamin D, zinc, You can use some EPA, DHA, some good high quality fish oil. LDN, I mean, you need to start treating this as autoimmune. Melatonin. Dr. Smith raves about melatonin and all the ways that it helps patients with COVID, including stopping the angiotensin 1 and 2. And there's so many ways that it helps modulate. It's just terrific. You have to remember gut health, and gut health is because 70% of your autoimmune system comes from your gut. Again, CBD and Berkeley Life nitric oxide, these are for moderate cases, so they don't turn into more severe cases. Again, these are all patients that's coming and asking you for advice. These are great opportunities for you to, number one, help your patients. And by doing that, you're actually making a profit. So I always look at it as if I do the right thing and give my customer the value that they deserve, they will pay me the money I deserve. I stuck this in here and I'm just going to breeze through it. If you get a hospital administration, besides all the stuff that they will do in the hospital with antibodies or whatever they're doing, these are the things that Dr. Smith recommends. Long haul COVID, I was shocked to learn that up to 80% of people that had COVID have one or more long haul symptoms, and it needs to be treated as if it was an autoimmune disease. And the treatments for these different things really depends on the body parts affected. I mean, some of these people have POTS. So LDN, everyone should be on LDN. I mean, LDN is just good for everybody anyway. LDN, you know, a good fish oil, vitamin D, probably nitric oxide and CBD are probably 5 things that everybody should be on just all the time. If the person is having trouble regaining taste and smell, Theophylline nasal spray if you're a compounder, vitamin A nasal drops if you're not. If you're having patients that have an anxiety, brain fog and stuff, oxytocin nasal spray. We're using some ketamine for that. I use a lot of ketamine. We buy ketamine by the kilo. We do so much ketamine. I mean, the stuff is fantastic for so many things. If you'd like to have a conversation about it, I'd be happy to. Nutritional support. You got to eat right. I mean, these people need to be having nutritional support, not only through supplementation, but food. Goes back to your gut health. 70% of the autoimmune comes from your gut. Anti-inflammatory diets. Sugar is very inflammatory. The average American eats 3 pounds of sugar a week. 200 years ago, they ate 2 pounds a year. And it's just inflammatory. It's in everything. The old saying is, whiter the bread, the quicker you're dead. Patients that are having lots of problems have very high ferritin levels. Now, we have a phlebotomical staff and we can draw some of these labs. But if they have high ferritin levels, either they got to get some chelation or they've got to go get blood. Viral persistence is a problem. Again, you want to use these same things we're talking about, whether it's the iodine nasal spray, brain fog, you want to use oxytocin, some of those things. Depression, you can use oxytocin, will help. Anxiety, also ketamine is another good choice. Again, CBD, it just is good for everybody. It's anti-inflammatory, it's anti-cancer, it is 6 times better than anything else in your pharmacy for nerve pain. So in life, you have 3 kinds of pain. You have nerve pain, bone pain, and soft tissue pain. Bone pain, obviously, you just use NSAIDs and ruin their stomach and kidneys. But if they have nerve pain, you normally give them anti-seizure and antidepressants, which are only about 10% effective. CBD is 6 times more effective for nerve pain, and it's regenerative for nerves. So it's just an excellent thing to do. And the big point here is that there are a mast cell stabilizer, which we were just talking about how important it is to stabilize mast cells. Again, super important for our COVID patients, long haul COVID. And I want to end with this. You are the pharmacist. if you want to get paid up here, practice up here. If you want to get paid down there, practice down there. It's up to you to help these patients. They are dying for information. And if you do that and you give them the value that they deserve, you'll get paid. And all you have to do is decide to do it. They're willing to talk to you. And I get, you know, I'm a little light there. I give every one of my patients a money back guarantee. Anything that I sell you, you don't think was successful, you just bring it back, because I'm here to help you, not just take your money. And so with that, I'll be happy to answer any questions. Did I beat my 10 minutes? Did I do good at Dave?
I think you did fair.
Debia, what's been your biggest hurdle on some of this? You know, you're into quite a bit of stuff. So what's been a big hurdle for you on starting some of these things?
Well, you know, business is really three things, right? Inventory, AR, and salaries. I mean, that's business. I mean, that's it in a nutshell. And if you're not monitoring those, and growth is your blessing and enemy. If you're not growing, you're dying, and it costs money to grow. So there's a two-edged sword. If you grow 40% or you cut expenses 10%, you make the same amount of money. But I can tell you, growing is a lot more fun. Cutting is a lot more difficult, but you need to do both. And so you have to figure out how to grow and what parts of the business grow that you can afford. So what I've done is I've chosen, I don't do anything that's not got 50% profit or better, because I got to fund my own growth. The banks ain't going to fund your growth, but so much. So the biggest hurdle is to make sure that you keep your team focused and stay on these things to be successful. So for instance, I have a Dr. Reed, Jamie Reed, who works for me. She is a full fellow in functional medicine through A4M. It took us 2 years, maybe a little bit more than 2 years, to get her to where she is paying for a salary and making me money. And today, as of, well, the last 3 or 4 months, she's averaging over $1,200 a day in paid consults. So now she's paying her salary and making me money. And I do not incentivize her with any testing or supplement sales, because I don't want her to be incentivized to push stuff on people. I want them to give people what they exactly need, not anything additional. But because of that, we now sell between supplements and CBD probably $60,000, $70,000 or more a month in just those. And the amount of testing we do, I looked it up, just GI maps, just that one test, we did about 170 last year, and we're on pace to probably add 50% to that this year. And they're $370 a piece or something, and we make about 80, $90 on them. And so, and then the person has to come in for our consults. We charge $225 an hour, or we have several subscription models that you can give us your credit card. In order to get a consult, you have to give us your credit card and get billed up front when you make the appointment online. So all those were hurdles. People will tell you all kinds of stuff. Every functional practitioner I know that has an all cash model is full and have a waiting list of months or years. People are dying for this kind of service. They want somebody to connect the dots. We are biochemists. We understand metabolic pathways. We understand nutritional depletions. We should fix them. That's my story. I'm sticking to it.
Like to turn to Chuck Snyder from Ananda, our sponsor for tonight. Chuck, do you have something you'd like to talk and cover with? We appreciate your support.
Thank you, Dave, and it's a pleasure to be with everybody tonight. Can everybody hear me okay?
Can hear you great.
Okay, great. All right. Well, I really want to thank all the presenters before me. I've learned a whole lot just by listening, so thank you. And what I thought I'd like to do is just talk to you a little bit about the CBD space and go through a patient population that all of you all can relate to, and that's the sleep patients. United States, 1 in 4 adults have problems with sleep, and you deal with these patients regularly. The good thing is that a lot of patients are really actively looking for options. Melatonin was just mentioned by TW. Certainly that's an option, but increasingly people are looking for functional ingredients or natural alternatives. And those patients are really gravitating towards CBD or hemp extract. So it's a very large patient population. And the good news is that they're actively looking for you for advice. When you look at the number of conditions that CBD can affect, now the endocannabinoid system's role is to maintain homeostasis, and the CB receptors that are found throughout the body, they help interact with various systems and organs to help provide balance and homeostasis. So there are a number of opportunities for CBD, but I wanted to just talk a few minutes about the sleep patient. So there's about 70 million Americans that have sleep disorder. In your pharmacy, you may be filling 9 or more prescriptions a day. So it's a pretty common patient population in which to focus on. And at Ananda, we've been providing CBD to independent pharmacies for 4 years now. And we find that some of our most successful pharmacies will start with a particular patient population. And that's why I've decided to share with you a little bit about what we're doing in the world of sleep. Certainly you can veer to other patient populations, but sleep is a very, very prominent one. And it's an easy conversation for you and your teams to have. Now, one of the things about the cannabinoids that are found in hemp extract is that there are numerous ones. CBD is probably one of the most widely known, as well as THC, but there's a minor cannabinoid called CBN or cannabinol. Now, that cannabinoid has been shown to have a really good relaxation effect. So it's like CBD is going to work on the endocannabinoid system and to help provide an enhanced effect on sleep. And so what we've done at Ananda have really reformulated our regular full spectrum tinctures. You can see on the left our regular tincture, which is a full spectrum product, and you can see the various blends there. It's largely CBD, but we have up to 8% other minor cannabinoids and a little bit of THC. What we've done with the Ananda PM tinctures is to elevate the profile of CBN in this formulation. So it represents about 15 to 20% of the overall cannabinoids in each of the tinctures. And the response that we're seeing from our pharmacy and their patients has been very, very positive. Typically, patients are falling to sleep quicker, and they're getting good REM sleep. So that is a big difference in our PM tinctures, is the elevation of that minor cannabinoid called CBN. Now, with POA, we have a awesome partnership. It's a partnership that provides you with an instant 15% discount. What we have promoted here is a bundle that features the PM's tinctures, and we make 3 different strengths of tinctures: a 600 milligram strength, 1,000 milligram, and a 2,000 milligram strength. So in this package, you would get those 12 tinctures for sleep. And we also are adding the roll-on. The topical roll-on, the soothing roll-on, is our #1 selling topical agent. And many times people that suffer sleep may have a concomitant pain issue. So the roll-on is a way, different mechanism of action to address pain, which may be commonly associated with sleep disturbances. So you can see here the price of this particular bundle, and you don't have to necessarily take advantage of this, but this is a very good opportunity. Is $773. The retail is $1,800. And with all Ananda products, your gross margin, your gross profit is usually around 50%. These particular products do come with full marketing support to help you engage customers in your store about sleep. And I'll point some of these out. If you're not taking advantage of this CBD usage guide in your practice, please do. We make them available for free. And the purpose of the CBD usage guide is really threefold. It is a piece that you can help explain how CBD should be dosed and titrated. It is also a wonderful way for you to track your patient's journey on CBD. And with CBD, everybody is a little bit different. Their dose may be idiosyncratic. So it's really important to have a journal where that patient can not only track what dose they're on every day, and generally we recommend every 3 days, increasing the dose by 10 milligrams, but they can also track the score of their symptoms. So on this journal, it's been very powerful to have patients walk out the door with their purchase to use this dosing journal so they can track it and they can share it with you. At the end of 10 days, in fact, if they did not get the benefit that they were looking for, well, then Ananda will replace that product for you at no charge. So your patient actually has a money-back guarantee. Have them take the journal with the product, keep score, and in very rare instances, do patients return a product for a refund. So these are again available through your Ananda account executive, and there's absolutely no cost to it. Around the sleep program as well, the marketing support is listed here. This is an example of one of the posters. It's a 2-foot by 3-foot poster that you can hang in the store or at the drive-through window. We provide you the bag stuffers that talk about the prevalence of sleep and how CBD and CBN can help with sleep issues. The journals I just mentioned, as well as shelf wobblers. Many of you probably have sections in your store dedicated to certain conditions. This is an example of a sleep area where you'll find melatonin. That would be a great area in which to use that shelf wobbler to call attention to the fact that CBD could be a very good option for patients that are having sleep issues. And again, your Ananda account executive can provide you with these in-store marketing pieces at no cost. I guess finally, I'd like to reiterate, the profitability opportunity that CBD represents. Earlier, we were talking about administering COVID shots and $40 reimbursement. Well, CBD is somewhere in that neighborhood as well. We see on average about a $35 profit per patient. And one of my favorite things when I talk to pharmacy owners about CBD and the opportunity it represents, you have many patients every day that you can have a conversation with about CBD. And if you have those conversations, patients will trust you and try the product. But if you just start one patient a day and you do that for the course of a year, you'll have over 240 patients at the end of the year. Well, your profitability just for those 240 patients is $55,000. Okay. If you do nothing in year 2, because generally they're using CBD for a chronic condition like pain or sleep or anxiety, if you just maintain those same patients for the following year, your profitability is up over 100,000. It's there. It's a very easy conversation. Our account executives pictured below are more than glad to help you be successful and provide you with, pro tips like I've just gone through to help you target patients and help you engage them and get them to try CBD. I had just 2 more quick slides, and then I'd be glad to answer any questions about sleep or our programs. But we are a research-driven CBD company. We've invested $40 million in clinical research. We do this to advance the knowledge of the clinical evidence of hemp extract or CBD. We do not do this to seek an NDA and make our products prescription. We know we can help a lot more patients by keeping them over the counter. However, for clinicians like you all, we want to be able to support our products with good, valid research. We're extremely proud of those 4 studies that you see in the red boxes there. Ananda is the only FDA authorized CBD OTC brand for IND research. So we have 4 FDA authorized studies underway, 1 in neuropathic pain, 1 in sleep and anxiety patients, 1 in cognitive decline, and another one in substance abuse disorder. So all these trials are underway, patients are enrolled, and so we're very, very excited about advancing that knowledge of the potential of hemp extract. The final thing I did want to point out is if you would like to work with Ananda, it's very easy. As a POA member, please take advantage of the 15% discounts that you all are provided with our relationship. You can easily contact your Ananda account executive, either the phone number or the website. But that concludes my presentation. I'm glad to answer any questions that you might have about sleep or CBD.
Yeah, I have something. This is Tim.
Hey, Tim.
Now, I'm in New York, and of course, marijuana is legal, and CBD is legal. But because the federal government has not made it really legal, the Board of Pharmacy, even though they know pharmacies have CBD in them, you cannot have CBD behind your pharmacy counter. And you can't promote it as doing anything. So we at one time had window signage indicating the use of it, but we had to take it down and just put, another window signage that we're just a pharmacy. Even though we do sell CBD, it's not in the pharmacy, it's outside the pharmacy. But we have to be careful because even though, like I said, marijuana is legal in New York State, the Board of Pharmacy hasn't caught up, and to them, it's still Schedule 1. So as long as it's not in the pharmacy, we're okay. But they would come in and they would look to see if we're promoting it, we have any advertisement promoting any usage of it, just because they're going to follow the FDA ruling. That's how backwards they are. Even though, like I said, almost every pharmacy does have CBD, you're sort of on pins and needles when they come in. And I'm just wondering if that's happening in other states too.
I can speak for Oklahoma that the product that we carry has to be THC free. It can't be less than a percentage THC. It has to be completely free of THC. In Oklahoma, medical marijuana is legal. So I have all kinds of dispensaries. There's something like 3 or 4 dispensaries for every pharmacy in our state. And, they're all selling everything, gummies and, everything from straight up weed to gummies to whatever. but pharmacies are only allowed to carry the THC-free, certified THC-free product. So that limits for us, that limits the Ananda product line that we can carry. But I don't know how that, whether that really answers your question regarding what's going on in other states, but that's what it is here.
I'd be curious what Chuck and Ananda, have to say different states. I've gone to them for California before. Marijuana is in California. We can all walk around with it if we want. But same thing with CBD, CBN. It's different, right? So I think the pharmacies I've seen do a very good job with this are talking to their patients. This is a different kind of product. Their sleep product, for example, is different than smoking marijuana. Their daytime product with the pills and the drops are different than smoking marijuana. So it's just talking to patients and doing what you're allowed to do per your state. But I would think Chuck and your team, you guys probably have a good idea per each of these states, what they can and cannot do. As of California, where I'm at, if we were talking a year and a half ago, we could only do topicals and things like that. And now recently that has changed. So we can do everything. We have stores. Ty, for example, on this call is doing a full line, doing pretty well with it now. We're starting to carry it, and more of our California stores starting to bring it in. But it's just different. This is not, even though it has THC in it, I think the majority of my stores that are doing a good job with it are marketing it as it's a different kind of product. CBD is not marijuana. You can smoke marijuana, if that works for you, great. If you want to try both, try something else. It's just about talking to your patients. I think TW does. Everyone on this call probably does the best job of coaching and upselling his patients on what that is and why that's different and how it can be helpful with or without marijuana, with or without different medications. It's just all about educating your patient base,
Yeah, I can tell you when we, first had the Farm Bill pass in late 2018, it was really a very different legal landscape for many of the states. While federally it removed hemp from the Controlled Substances Act, still there was a lot of work to be done at the state level, and there continues to be a lot of work done, as you all have shared. Federally, though, we are very, very optimistic about some bipartisan legislation that seems to have some traction. It's called HR 841. And it would actually be Congress's attempt to put in some needed guidance and oversight and regulations on the marketing of dietary hemp as a dietary supplement. So it's something that FDA has really drugged their feet on, but we are very optimistic by the bipartisan nature of HR 841, and we hope to have this bill passed perhaps early this fall. So if that occurs, then that would provide some very good sound regulation requiring CGMP practices for all manufacturers, for instances, and specific ways that CBD can be legally marketed. So we're definitely keeping very close watch on that bill.
I know living in the state of Florida that there's a license that you have to buy, I believe, for the internal stuff. If you're doing an internal, I think it's $650.
Yeah.
Yeah, it's a food license because they consider it as a food, and basically like if you sell chocolates or something, you need that license. But it's that's it. So I'm after hearing you guys, I feel that I'm glad that I'm in Florida. So basically it's free roll.
I got just a couple general comments about CBD. Our job as pharmacists is to help our patients become healthier, not necessarily just fill prescriptions for them, because sometimes prescriptions we're filling for them are making them worse. And I've got patients that have called me up on the phone crying because of the relief they've got from nerve pain. I had a lady that was an MS patient, and her spasms were so bad she couldn't get a night's sleep because it kept waking her up all night. and she's on all the baclofen and the usual things. She took CBD, the first dose. She slept all night and had no spasms that woke her up. I mean, these things can be life-changing for people. And does that happen to everybody? Of course not. But the people that it helps is dramatic. I do a lot of pain and medicine, a lot of addiction medicine. And it just works terrific. I'm in the process right now of working with some physicians that have a lot of these nerve pain patients, and we're putting together a nerve pain protocol. We're going to use LDN, topical LDN, CBD, nitric oxide, and then we'll go down the road of ketamine from there. But you have a protocol that you can do that actually gets relief. And so it's some really wonderful things that happen with this. And it's a shame that it's a little mercury now, but it is really life-changing for these patients. The reason that the study is going on in Norfolk, I happen to be familiar with that one, Eastern Virginia Medical School, the doctor that's doing that study called me and said, I didn't know him from Adam. And he says, one of my patients is taking that stuff from you, and I want you to come tell me about it. So I showed up to tell him about it, and he had a whole team of people there. And so I ended up giving this big presentation, and they got in touch with Ananda, and they funded the study because his patients that had Alzheimer's, the behaviors were so much better, he couldn't believe it. And you're talking about autistic patients and 2E patients. I mean, it is phenomenal for those patients. Asperger's, I mean, and so it's an opportunity for you to really make a difference while making a profit. And again, it comes back to people are willing to pay you for the value. And so that's my 2 cents. And I've had a great relationship with Ananda. I think they have the best product on the market, and they definitely have the best research. Nobody else can touch them with that. And I want to stay with the people that support me.
TW, it has taken you a long time to blaze the trail you have blazed. You have a lot of wonderful things working for you now. If you were approached by a store that was, say, filling 120 prescriptions a day and was not around someone, didn't have a mentor, if you will, to hold their hand through a process or help guide them on something, trying to work through a path similar to yours, where would you suggest they start?
I think the first thing is mindset. You got to think differently. I think Albert Einstein said, you can't solve today's problems with the same level of thinking that created them. So one of the things that's been really helpful for us is I get out in the community. You go talk to doctors, try to go to their, meet them where they are, whatever that is. We give talks to the public. So if you look at my website, for instance, the first thing pop up is if the Rotary Club, the Lions Club, if somebody needs a speaker, we provide them a speaker. And on multiple, so get involved so you're working on your business, not in it. And I think that then they will dictate to you what their needs are that you can fulfill. And we kept finding those cash ways of doing it. And that's how we got to where we are. If somebody wants to do it, it would be much better for them to probably spend some money with us so you don't have to reinvent all those wheels. Like for instance, what EHR to use? How do you connect it with your pharmacy system? All those things, how do you monitor your inventory? All those are really tough questions that we've had to work through, and we're just solving some of them now. I hope that answered your question, Todd. I don't know.
Yeah, that's a good answer. I'm just trying. I know that there are folks that are going to watch this or maybe currently watching this and thinking that guy's got it going on. How do I get started down that path? Because you've accomplished a lot of things, and it's taken you a lot of time to get there. But every journey starts with a step. And so we need to help these folks understand what's the first step?
My mission for me personally is really two things. One is to change the way pharmacists practice, because what we do in there doesn't work and we're not utilizing our talents. The second thing is that the people that helped me develop all this, I want to do some kind of a modified ESOP or something, so the people that helped me do all this, my business continues to go. It has long legs for a long time. And the people that are 30 and 40 years old, they get to have this forever, and they can just keep paying my state a little something, and that's better for both of us. And so that's kind of what my goal is. And I said that to say, any independent that I can help, I'll be more than happy to help. Somewhere in there, I may need to get paid a little something, but I'm really willing to try to help everybody, because the door has swung open. Medicine is treating sickness. We have the opportunity to treat wellness. And it's a big difference there.